Hello, everyone. Today we start the study of the pectoral muscles. First, let's review the superficial dorsal muscle group we learned in the previous class. The superficial dorsal muscle group includes the trapezius, latissimus dorsi, levator scapulae, and rhomboid muscle. The pectoral muscles can be divided into two groups. One group is the pectoral and upper limb muscles, thoracoupper limb muscles, which are located on the anterior and lateral sides of the chest wall. The superficial layer consists of broad muscles that insert into the pectoral girdle bones or humerus. The other group is the thoracic proper muscles, which participate in the formation of the chest wall and retain their segmental nature. The pectoralis major is superficially located, broad and fan-shaped, covering most of the anterior wall of the thoracic cage. It originates from the medial half of the clavicle, the sternum, and the 1st to 6th costal cartilages. Its muscle bundles converge outward and insert via a flat tendon into the greater tuberosity crest of the humerus. Function: it adducts, medially rotates, and flexes the shoulder joint. When the upper limb is fixed, it can lift the trunk and work with the latissimus dorsi to complete pull-up movements. It can also lift the ribs to assist in inhalation. The pectoralis minor muscle is located deep to the pectoralis major and has a triangular shape. It originates from the 3rd to 5th ribs and inserts into the coracoid process of the scapula. Function: it pulls the scapula forward and downward. When the scapula is fixed, it can lift the ribs to assist in inhalation. The serratus anterior is a broad, flat muscle located on the lateral wall of the thoracic cage. It originates from the lateral sides of the upper 8 or 9 ribs with several muscle teeth. Its muscle bundles run obliquely backward, upward, and inward, pass in front of the scapula, and insert into the medial edge and inferior angle of the scapula. Function: it pulls the scapula forward and makes it closely adhere to the thoracic cage. Its lower muscle bundles rotate the inferior angle of the scapula outward to assist in arm elevation. When the scapula is fixed, it can lift the ribs to assist in deep inhalation. If this muscle is paralyzed, the inferior angle of the scapula will separate from the thoracic cage and protrude under the skin, a condition called winged scapula. In this case, the arm cannot be fully lifted or pushed forward. Thoracic proper muscles. The intercostal centurni is located deep to the intercostal sexterni. They originate from the upper edge of the lower rib and insert into the lower edge of the upper rib. The direction of their muscle bundles is opposite to that of the external intercostals. Their anterior muscle bundles only reach the junction of the rib and costal cartilage. In the costal cartilage space, they transition into a sheet of connective tissue membrane called the external intercostal membrane. Function: they lower the ribs to assist in exhalation. There are 11 pairs of intercostal sexterni, located in the superficial layer of each intercostal space. They originate from the lower edge of the rib, with muscle bundles running obliquely forward and downward, and insert into the upper edge of the next rib. Their anterior muscle bundles only reach the junction of the rib and costal cartilage. In the costal cartilage space, they transition into a sheet of connective tissue membrane called the external intercostal membrane. Function: they lift the ribs, expanding both the longitudinal and transverse diameters of the thoracic cage to assist in inhalation. After learning about the pectoral muscles, let's look at the shoulder muscles of the upper limb girdle muscles. The upper limb girdle muscles are distributed around the shoulder joint. They all originate from the pectoral girdle bones and insert into the humerus, enabling movement of the shoulder joint and enhancing joint stability. The deltoid muscle is located at the shoulder and has a triangular shape. It originates from the lateral segment of the clavicle, the acromion, and the scapular spine, corresponding to the insertion site of the trapezius. Its muscle bundles gradually converge outward and downward, inserting into the deltoid tuberosity of the humerus on the lateral side of the humeral shaft. The upper end of the humerus is covered by the deltoid, giving the shoulder a rounded shape. Damage to the axillary nerve can cause paralysis and atrophy of this muscle, making the acromion protrude under the skin. Function: it abducts the shoulder joint. Its anterior bundle can flex and medially rotate the shoulder joint. Its posterior bundle can extend and laterally rotate the shoulder joint. The supraspinatus muscle is located deep to the trapezius and originates from the suprascapular fossa of the scapula. Its muscle bundles run outward, pass below the acromion and coracoacromial ligament, cross the shoulder joint, and insert into the upper part of the greater tuberosity of the humerus. There is a large subacromial bursa between the supraspinatus tendon, coracoacromial ligament, acromion, and deltoid. Infection of this bursa causes pain when abducting the shoulder joint. This tendon is also one of the most easily ruptured tendons around the shoulder joint. Function: it abducts the shoulder joint. The infraspinatus muscle is located in the infraspinous fossa. Part of the muscle is covered by the deltoid and trapezius. It originates from the infraspinous fossa, with muscle bundles running outward behind the shoulder joint and inserting into the middle part of the greater tuberosity of the humerus. Function: it laterally rotates the shoulder joint. The teres minor muscle is located below the infraspinatus and originates from the dorsal surface of the outer edge of the scapula. It inserts into the inferior part of the greater tuberosity of the humerus. Function: it laterally rotates the shoulder joint. The teres major muscle is located below the teres minor, and the posterior side of its lower edge is covered by the latissimus dorsi. This muscle originates from the back of the inferior angle of the scapula, with muscle bundles running upward and outward, passing along the medial side of the arm and in front of the long head of the triceps brachii, and inserting into the crest of lesser tubercle of humerus. Function: it adducts and medially rotates the shoulder joint. The subscapularis muscle is triangular and originates from the subscapular fossa. Its muscle bundles run upward and outward in front of the shoulder joint and insert into the lesser tuberosity of the humerus. There is a large subscapular bursae between the tendon and the scapular neck, which communicates with the shoulder joint. Function: it adducts and medially rotates the shoulder joint. The glenoid fossa of the shoulder joint is shallow while the humeral head is large, and the joint capsule is loose. Its stability mainly depends on the surrounding tendons. The tendons of the subscapularis, supraspinatus, infraspinatus, and teres minor insert into the anterior, superior, and posterior sides of the shoulder joint respectively. Their tendon fibers interweave with the joint capsule fibers to form the rotator cuff. Although these muscles function to move the shoulder joint, they are very close to the joint and have limited force. However, when these muscles contract, they can keep the humeral head in contact with the glenoid fossa, thereby enhancing the stability of the shoulder joint. In addition, the deltoid also plays a role in maintaining the stability of the shoulder joint. Everyone, in this class, we have learned about the shoulder muscles. In the next class, we will start learning about the arm muscles. Thank you.